You're standing in your kitchen waiting for the kettle to boil. Nothing dramatic is happening, but if someone asked you to stand there on one leg right now for 20 seconds, would you be able to do it? That one small question is the reason we're making this video. There's a handful of simple physical tests, the kind that take less than a minute each, no equipment, no appointment, no waiting room. And they're the same tests physiotherapists and geriatric doctors around the world use to get an early read on fall risk. Most people who could benefit from knowing this have simply never heard of them. This isn't about scaring anyone, it's the opposite. Falls after 70 are common enough that the World Health Organization lists them as the second leading cause of injury-related death for people over 65 worldwide. And yet very few people ever get the chance to check, quietly at home, whether their own balance and strength are where they should be, before a fall happens, not after. By the end of this video, you'll know 3 of these tests. How to do each one safely. What the numbers actually mean based on real published research. And what a good next step looks like, whichever way your results land. One thing before we start. This channel exists to help people stay informed and stay independent longer. Everything here is educational. It's not a diagnosis, and it's not a substitute for your own doctor. If anything here raises a question about your own health, that's exactly the kind of question worth bringing to your physician, especially if you're managing a medical condition or taking medication. With that said, let's start with the test that researchers currently consider one of the most telling of the 3 DAs. And it takes about as long as this sentence to explain. It's called the single-leg stance test, and it's exactly what it sounds like. It's worth pausing on just how much weight sits behind that one sentence. In the United States alone, falls among older adults account for millions of emergency department visits and hundreds of thousands of hospitalizations every year. And roughly 1 in 5 falls results in a fracture or a head injury serious enough to need medical attention. None of that is meant to alarm you. It's meant to explain why researchers have spent so many years building tests as simple as the ones we're about to walk through. When a problem is this common, a 30-second test that anyone can do at home with no equipment becomes genuinely valuable. Before we get into the how, it helps to understand why balance changes at all, because it isn't one single thing failing. It's 3 separate systems, each aging a little differently, working together every time you stand up from a chair. The first is muscle. Leg and hip muscles naturally lose some mass and power with age, a process doctors call sarcopenia. And it's one of the most well-documented changes in aging bodies. Less muscle power means less ability to catch yourself if you start to tip. The second is the inner ear's balance system, the vestibular system, which senses motion and head position. It quietly loses some sensitivity over the decades, which is part of why a quick head turn or a fast direction change can feel less certain than it used to. The third is sensation in your feet and joints, called proprioception, your body's ability to know where your foot is without looking at it. Nerve signals from the feet upward tend to slow slightly with age, which delays the tiny automatic corrections your body makes hundreds of times a day without you noticing. None of these 3 changes, on their own, causes a fall. But together, they explain why balance and reaction time both shift gradually over the decades. And they explain exactly why these 3 tests work. Each one is quietly measuring a different piece of that same 3-part system. Here's how you do it. Stand near a wall or a sturdy chair just in case, especially the first time. Lift one foot slightly off the ground, without holding on if you can help it, and see how long you can hold that position before you need to put your foot down or grab something. Time yourself, or have someone time you. Try it on both legs. Now here's where the research gets interesting. A study published in 2024 in BMC Geriatrics followed 153 community-dwelling older adults between 60 and 89 years old for 6 months. Everyone did the balance test at the start. Then researchers simply waited and called monthly to see who fell. The people who went on to fall could hold the single-leg stance for an average of 10.4 seconds. The people who didn't fall held it for an average of 17.2 seconds. Same test, same age range. A 7-second gap that turned out to matter. And this lines up with older research too. Back in 1984, a researcher named Bohannon measured this same test across age groups. People between 60 and 69 years old held the position for an average of 22.5 seconds. People just 1 decade older, between 70 and 79, held it for an average of 14.2 seconds. That's a real measurable drop in a single decade of life. Not a guess, not a scare tactic, just what the data shows. There's something else worth knowing. For years, the standard version of this test only measured up to about 10 seconds. But newer research is now suggesting that 10 seconds isn't long enough to catch subtle balance problems. Some researchers now recommend extending the test to 23 seconds or more, because each additional second you can hold the position appears to lower fall risk in the following 6 months by roughly 5%. That's not a small detail. That's the field quietly updating what safe actually looks like. Before we move to the second test, this is a good moment to hit subscribe if you haven't already. This channel is built around exactly this kind of information. Real research, explained plainly with nothing invented. If that's useful to you, subscribing means you won't miss the next one. And if you've got a moment, drop a comment with your single-leg stance time. It helps other people reading the comments get a sense of where they stand too. A like helps this reach more people who could use it. And if you know someone who'd benefit from this, sending it their way costs you nothing and might help them a great deal. Now the second test doesn't test balance on its own. It tests something a little more complete. How your body moves through a whole sequence, the way it would in real life. It's called the timed up and go test, and physiotherapists sometimes just call it the TUG. Here's how it works. You start seated in a chair with arms, ideally one without wheels. On a signal, you stand up, walk forward 3 meters. That's about 10 feet, roughly the length of a small car. Turn around, walk back, and sit back down. Someone times the whole thing with a stopwatch, from the moment you start standing to the moment you're seated again. This test has been recommended as a routine screening tool by geriatric medical societies in both the United States and the United Kingdom, because it captures several things at once: how you rise from sitting, how steady your walking is, how well you turn without losing balance, and how safely you sit back down. So what do the numbers say? Healthy older adults with no major health concerns typically complete this test in about 6 to 11 seconds. Research has settled on a commonly used threshold of around 12 to 13.5 seconds. Cross that line, and you're in a range researchers associate with meaningfully higher fall risk. Times above 20 to 30 seconds are consistently linked to serious mobility limitations, often the kind where extra support at home starts to make sense. One review looking at people who had already experienced falls found something striking. Recurrent fallers, people who'd fallen 2 or more times in the past year, averaged over 52 seconds to complete this test, compared to about 7.4 seconds in people who hadn't fallen at all. That's not a subtle difference. That's a test picking up on something real. Now, one honest caveat, because this channel doesn't deal in half-truths dressed up as certainty. Researchers are clear that the TUG test on its own isn't perfect. It's better at confirming that someone is at risk than it is at ruling risk out completely, which is exactly why doctors don't rely on just one test. And it's exactly why we're covering 3. That brings us to the third one, and it's the one that most directly measures something you use dozens of times a day without thinking about it: the strength in your legs. It's called the 5 times sit-to-stand test, and it might be the simplest of the 3 to try right now, wherever you're sitting. Find a chair with a straight back, roughly knee-height, without arms if possible, and place it against a wall so it doesn't slide. Cross your arms over your chest. No pushing off with your hands, no using the armrests. Starting from seated, stand all the way up, then sit back down, 5 times in a row, as quickly as you safely can. Time the whole thing from your first stand to your 5th time sitting back down. This test has been studied for decades because it's a clean measure of leg strength, and leg strength turns out to be one of the most consistent predictors of fall risk there is. Different research groups have landed on slightly different thresholds. Some studies point to 12 seconds, others to 15. One large study specifically to flag risk of recurrent falls. One study, led by a researcher named Boitoas, found that people who took longer than 15 seconds to complete the test had a 74% greater risk of falling repeatedly. And here's something encouraging buried inside all of this. Unlike some health markers that feel fixed, leg strength responds to use. Small clinical studies tracking people through structured exercise programs have recorded 5 times sit-to-stand scores improving by several seconds over just a few months. This isn't a life sentence. It's a starting measurement. But it's worth being honest about something else here. No single test, and not even all 3 together, tells the whole story. The Centers for Disease Control and Prevention runs a program called STEADY, built specifically to help doctors screen older adults for fall risk, and their framework looks well beyond balance and strength alone. It also looks at vision, medications, footwear, and hazards inside the home itself. Vision matters more than most people expect. A blurred or outdated prescription changes how you judge a curb, a step, an uneven bit of pavement, long before your legs are the problem. Medications matter too. CDC research has tracked a rise in older adults taking medications linked to increased fall risk, including a jump in opioid use from about 15% to 35% of older adults over a 15-year period, and anticonvulsant use nearly tripling in that same window. Many of these medications affect balance or alertness in ways people don't always connect to their footing. Footwear is on that list too. Worn soles, poor support, or shoes that don't fit properly all show up repeatedly in the research as quiet contributors to falls. So does something as ordinary as a loose rug or a poorly lit staircase at home. None of this means every medication is dangerous or every rug needs to go. It means fall risk is rarely just one thing. It's usually a handful of small factors stacking on top of each other. And unlike your age, every one of the factors just mentioned can be reviewed and adjusted, often with a single conversation with your doctor, your pharmacist, or an eye care professional. Now, if any of these 3 numbers gave you pause, Here's the part of this video that matters more than any of the cutoffs you just heard. None of this is fixed. Balance and strength both respond to training at any age, and there's real research behind exactly how much. One well-studied program called the Otago Exercise Program was designed specifically for older adults and combines simple leg strengthening moves with balance exercises, usually done at home a few times a week. Across a series of randomized trials, it has been shown to reduce falls by somewhere between 23 and 40%. In one trial, specifically following adults over 70 who had already fallen at least once in the past year, the program lowered the rate of subsequent falls by 36% compared to standard care. In New Zealand, where the program was originally developed, it's been shown to cut fall rates by up to 46% in community-dwelling older adults. Tai Chi has an even wider range of supporting research behind it. Systematic reviews pooling multiple randomized trials have found reductions in falls somewhere between 31 and 58% among people who practiced it regularly. It's slow, it's low impact, and unlike a lot of exercise recommendations, it was actually designed with balance as the central focus from the start, not as an afterthought. Neither of these requires special equipment. Neither requires a gym. What they require is consistency, and starting at a level that matches where your 3 test numbers put you today, which again is exactly the kind of thing worth discussing with your doctor or a physiotherapist who can tailor it to you specifically. It's also worth naming honestly who research finds tends to carry more of this risk. Age itself is one factor. Risk climbs meaningfully after 80, not just after 65. A previous fall is one of the single strongest predictors of a future one, which is exactly why doctors ask about fall history at checkups. And several large studies have found fear of falling itself is somewhat more commonly reported by women than men, alongside a generally higher documented fall rate among women in community settings. None of these are things you can change about yourself, and that's precisely why the CDC's own screening framework treats them as background context. Factors that raise the stakes of paying attention to the things you can change, like strength, medications, vision, and the home hazards we just walked through. There's one more piece of this that almost never gets talked about, and it deserves a few honest minutes, because it might matter more than any number you've heard so far. Research consistently finds that somewhere between a quarter and over half of community-living older adults describe themselves as afraid of falling. And that number climbs even higher, in some studies over half, among people who've already fallen once. That fear, on its own, sounds like a reasonable response to a real risk. The problem is what tends to happen next. Multiple long-term studies have found that fear of falling often leads people to quietly restrict their own activity. Skipping a walk, avoiding stairs, saying no to an outing they'd normally have said yes to. And that's where the pattern turns against the very thing it's trying to protect. Less movement means less practice for your balance system and less use of the leg strength these tests are measuring. One large longitudinal study following older adults over several years found that those who restricted their activity because of fear of falling showed significantly greater increases in frailty over time than those who didn't restrict their activity at all, even compared to people who had actually experienced a fall. So now you've got 3 tests: balance, held on one leg; whole body movement timed through the TUG; leg strength measured through sit to stand. None of them on their own tells you everything. But researchers keep coming back to the same conclusion: used together, they paint a picture that's far more reliable than any single number. And here's the part that I think deserves real attention, because it's not something most people ever get told. The cutoff points you just heard, 10 seconds, 12 seconds, 15 seconds. Those aren't fixed forever. They're being actively revised as research improves. The single-leg stance test used to stop at 10 seconds. Now researchers are pushing it to 23 seconds or longer, because the shorter version was letting real risk slip through undetected. That's not a flaw in the science. That's the science doing exactly what it's supposed to do, catching its own blind spots and correcting them. Which means the honest, useful takeaway isn't pass or fail. It's this. These numbers are a snapshot, not a verdict. If you tried these tests just now and the numbers weren't what you hoped, that is not a diagnosis, and it is not a countdown. Balance and leg strength are both things that respond to consistent movement, walking regularly, standing up from a chair without using your hands as practice, and gentle balance work near a wall or countertop. Are all things people your age have used to measurably improve these same numbers within months, according to the same body of research we've been walking through. If today's numbers concerned you at all, the single most useful thing you can do with that information is bring it to your doctor. Tell them exactly what you did and what time you got. A real physician can put that number in context with your full health picture, something no video, including this one, is able to do. There are also a few concrete, low-cost home changes that consistently show up in fall prevention research worth mentioning before we close. Making sure stairways and hallways are well lit, securing or removing loose rugs that can catch a foot, adding a grab bar near the shower or tub, and keeping a clear, unobstructed path between the bedroom and the bathroom for nighttime trips. These are the exact categories of hazard that occupational therapists are trained to look for during home safety assessments. And CDC guidance lists them among the modifiable risk factors that consistently make a measurable difference. It's also worth knowing calmly what to do if a fall does happen, because that knowledge itself reduces the danger. If you fall and you're not seriously hurt, the recommended approach is to pause for a moment rather than rushing back up. Check for pain before moving. And if you can, roll onto your side. Use a stable piece of furniture to help push up to a kneeling position and rest there before standing fully. If you're hurt or unsure, staying still and calling for help, a phone kept within reach or a medical alert device if you live alone, is the safer choice every time. None of this is meant to be frightening. It's the same reason we wear seatbelts in cars we don't expect to crash. Preparation that you'll likely never need but are glad to have if you do. This content is for educational purposes only and is not medical advice. Please consult your doctor before making changes to your diet or routine, especially if you take medication or have a health condition. Here's the thing about a kettle boiling in a quiet kitchen. Most of us never think about how we're standing while we wait for it. We think about the day ahead, or what we'll do once the tea is ready, or nothing at all. And that's exactly as it should be. Balance is supposed to be invisible when it's working well. That's what makes it so easy to overlook, and it's exactly why a test like this one matters more than it might seem to at first. Your body has been quietly keeping score this whole time, long before any doctor's visit, long before any fall ever happens. Muscles that have been doing a little less work than they used to. An inner ear that responds a fraction slower than it did a decade ago. Nerves in your feet sending signals just a touch behind where they once were. None of that shows up in a mirror. It shows up in seconds on a stopwatch, or in how long you can stand on one leg without reaching for something to hold. These 3 tests just let you look at that scoreboard, honestly, on your own terms today, while there's still plenty of time to act on whatever you find. And if what you find surprises you, that isn't a verdict on who you are or what's ahead of you. It's simply information, the same way a thermometer reading is information. Thermometers don't cure fevers, but they tell you enough to know what to do next and who to call. That's exactly the role these 3 tests are meant to play. Nothing more dramatic than that, and nothing less useful either. So try them, if you haven't already, while watching. All 3, if you can, safely, near a wall or a sturdy chair. Time yourself honestly. There's no version of this where rushing the number helps you. And if you're comfortable, put your results in the comments below. Not to compare yourself against anyone else watching this, and not as a competition, but because seeing where you actually stand, in plain numbers instead of vague worry, tends to be the first honest step towards staying steadier for a lot longer. If this was useful to you, subscribing means you'll be here for the next one. We'll keep bringing real, sourced research like this, explained plainly without the noise. A like helps this reach someone else who might need exactly this today. And if there's a parent, a neighbor, or an old friend who came to mind while you were watching this, sending it their way costs you 10 seconds and might give them a great deal more than that in return. Take care of yourself. We'll see you in the next one.